Welcome everyone. Many rheumatoid arthritis patients often ask me, Doctor, why don't you order the rheumatoid factor test every time during follow-up? Today, I'll answer this important question. I'm Dr. Hatem Eleishi, Professor of Rheumatology at Cairo University in Egypt. I also provide online consultations for patients living outside Egypt through my own platforms, and you're now watching my YouTube channel, Dr. Hatem Eleishi, Rheumatologist. Let's start the video. The first thing we need to understand is that the rheumatoid factor test or the anti-CCP test is mainly used at the beginning when a patient first presents with joint pain. Those two investigations play a supportive role, not a decisive one, in guiding us to suspect that the cause of joint pain might be an autoimmune arthritis. Their importance is that when they come back positive, they make the diagnosis of rheumatoid arthritis more likely, and they sometimes suggest that the disease may follow a more aggressive course compared to when they are negative. But the real deciding factor for disease severity is not the antibody numbers. It's the patient's actual symptoms, the physical examination, and if needed, specific imaging of the joints. So the main role of those two investigations is early on to help in diagnosis and to give us a rough idea whether the disease could be more aggressive or milder. But afterwards, these antibodies do not reflect disease activity and do not rise or fall in parallel with the joint inflammation. That's why we order them at the start, but we do not repeat them routinely during follow-up. So, what do we rely on instead during follow-up? The patient's complaints. Is there still morning stiffness, joint pain, swelling? The physical exam. Does the doctor find tender or swollen joints? Blood markers like ESR and CRP. Sometimes imaging, such as ultrasound or MRI of the joints if needed. So the goal in follow-up is not to see whether the rheumatoid factor or the anti-CCP test goes up or down. The goal is to rely on these other indicators to know if the disease is active or quiet and whether the treatment is effective or needs adjustment. And that's why repeating the RF test or the anti-CCP test every time is not useful. It only adds unnecessary cost for the patient. The problem is, despite all our efforts to explain this, many patients still insist on repeating RF and anti-CCP, and they bring them to every clinic visit. Sometimes they even skip the more important follow-up tests like ESR or CRP in favor of those two investigations. So I really hope every patient understands we doctors do not rely on these antibodies in follow-up, and insisting on repeating them will only waste your money. Now, another common question. Doctor, why do my rheumatoid factor or anti-CCP levels sometimes rise even though I'm taking my medications regularly and my arthritis is under control? This often causes frustration and makes patients doubt their treatment even though their joints are doing well. The answer is simple. Once positive, these antibodies are only a sign of autoimmunity. Later fluctuations don't reflect arthritis activity. They may rise for completely unrelated reasons. For example, if you had even a minor infection recently, like gum inflammation, these antibodies can increase for a few weeks. These antibodies can increase for a few weeks without you noticing any symptoms. So please don't worry about this. It doesn't mean your arthritis is worsening. In summary, RF and anti-CCP are helpful at the start for diagnosis and to some extent prognosis, but they play no role in disease follow-up. So if you're living with rheumatoid arthritis, don't be surprised if your doctor doesn't order them at every visit. And please don't keep repeating them on your own because they are not what determine whether your disease is active or not. I hope you liked this video and find it informative. Please don't forget to subscribe to my channel. And if you'd like to have an online consultation with me, please WhatsApp the number on the screen and they will arrange a consultation for us.